Hi, Raquel. Good to see you.
Hello, hello. Good to see you too.
Yeah, I was really impressed to hear your presentation a few days ago that I attended, that you working with a chronic pain client and having a tremendous result. And I was really super impressed. So I wanted to find out a little bit more about it. That's why I invited you to come along to meet with me today. And I really thank you for making time for this.
Well, thank you for inviting me. I'm so thrilled to be here talking with
Yeah.
you.
So can you tell me a little bit about yourself? Like where are you at? What background do you have? How did you ended up working with chronic pain people?
So I ended up working with chronic pain people by chance. So just people are in pain and they come to me because, well, I've been having good results like for a while. So it started with yoga, but now with TRE, I have better and better results. I do have, so I'm Portuguese.
Mhm.
I live in the south of Belgium, in the French-speaking part, where I have a yoga studio.
Mhm.
And I have a background, so I started my working life as a human resources manager. And
Mm.
then I specialized in occupational health, ergonomics. And then when I moved to Belgium, I started to work, I became independent, so an entrepreneur. I did different projects and I finally arrived at yoga and aerial yoga. And from there, I moved on to yoga therapy, and yoga therapy allowed me to discover TRE and
Mhm.
also somatic experiencing that I use now together,
Mhm.
yoga TRE and somatic experiencing. So I started to work, well, as a therapist, and I had some people coming with, my first cases were actually fibromyalgia.
Mhm.
And I started telling people perhaps we could try TRE and see what happens. And since the very beginning that I have very good results, but also very fast results with TRE.
Really?
So often in the first session, there is a difference. Sometimes there is like a big difference. And I had people that arrived in pain and the pain disappeared in the first session. Some people, it takes a little longer, but the little longer, often it's 4 sessions. So it's
Four sessions.
4 sessions. Normally, it's okay. So I don't do just one session.
Mhm.
I always offer a pack of 4, so the person can experience pain relief and then learn how to tremor and then learn to use it on their own. And then if they come back to me, it's because they choose to come back to work with me and not because they have to work with me because they are in pain. So
Oh,
after the 4 sessions, usually it's the person's choice.
wow. So after a single session or a package of four sessions, most of the people that you have worked with can tremor on their own, and not only that, they have a significant result from
Yeah, they do.
reducing their chronic pain.
Yeah, yeah,
So
yeah.
I would love to hear a little bit more of a specific cases that you have worked with. That if you can share it with us, that would be great.
So my first case with chronic pain was my own pain. Okay. So
Uh-huh.
I discovered TRE by chance. So I have a friend. She was the one telling me about TRE. She's called Birgit. She's
Uh-huh.
Austrian. And she told me, listen, look, like, look at my arm. And I told her, okay, yeah, your arm, it's kind of normal. So what happened? So she told me that when she was a kid, she broke her arm in very different places, and the arm never healed correctly. So
Mhm.
it was stuck like here, and she
Mhm.
couldn't bend it more than this. And she tried many different things, and nothing worked. And then she discovered TRE, and doing, I think, the certification, the arm like did this. And she told me about
Oh.
this. It's like, oh my God. So like some years ago, I actually twisted an ankle and it still hurts. So let me check it out and try it. So I started by
Mm.
doing it on my own. And then I was very impressed because it was really fast. So the ankle pain disappeared very, very fast. I used
Mm-hmm.
to have pain in the morning and going down the stairs after waking up, and it disappeared. So that's when I decided to move on and do the TRE certification. And since, well, I'm a TRE provider, that I've been helping people with chronic pain. I had very good results with people who had, for example, surgery and never. So after surgery, there is scar tissue, and sometimes it hurts because it
Yeah.
gets like kind of hard. So I had breast cancer survivor. She had pain after her operation. The pain never passed, and she was like for 2 years, like having this pain that she got used to. And
Uh-huh.
one day, by chance, so it was not a TRE session, it was not a TRE client, it was just like, oh, let's do some TRE in the end of a yoga class.
Mm-hmm.
And she was like, oh my God, it doesn't hurt anymore. So it stopped there, like in 10 or 15 minutes of practicing.
So she had a pain
She
after
had
a
she had
breast
pain
cancer
somewhere
surgery.
here, yeah. And it disappeared like in this like 10, 15
Wow.
minute TRE thing. So this was an interesting case, but I had interesting cases with fibromyalgia, for example, and joint pain, and then other cases. So some of my clients, for example, they were waiting for surgery and they avoided surgery. So knee surgery, cervical spine surgery, and lumbar spine surgery. So they had pain from different reasons. But with TRE, actually, they stopped having that much pain and
Mm.
they could actually avoid surgery. At least
Really?
3 persons. Yeah, yeah,
So there are three different people who
yeah.
had different levels, I mean, different pains in a different areas, and the
Mm-hmm.
doctors recommended to have a surgery, but they didn't want the surgery. But at the meantime, they tried TRE, and they didn't have to do the surgery. Is that what you're saying?
So uh, so I live in Belgium, and like some 2 years ago, I think, kind of, there was a hacking of the patient database, like,
Oh,
and so my client, he was limping, so he had chronic back pain and chronic ankle pain, and just before coming to the first TRE session, something happened with his knee, and he started limping, and he had a lot of pain in the knee, and he was waiting. Yeah, he thought, okay, probably I will need to undergo surgery, and he was waiting for all the exams that he had to do in order to do surgery, but the database was hacked. All his data was lost somewhere, and well, he ended up not doing any testing. But he came to TRE, and the limping stopped like in the first session. After that day, he didn't limp.
mm.
And then he kept doing sessions, and the knee recovered, and he didn't have more pain, and also the back recovered, and the ankle recovered, so he stopped having back pain.
So it's the one person who had three different pains, and then
He
all
had,
of them over time resolved.
yeah, all over time resolved, and his back condition, he had like some back problems in his vertebra. They recovered, and this was confirmed by his doctor, like some
Wow.
months after he started TRE. Yeah,
Wow.
yeah. So this was one of my first cases.
Hmm.
Another one that was interesting, that it was, well, not chronic pain like back, but migraines. So a boy,
Oh, yeah, yeah, yeah. A lot of people has a migraine, and it's like it's really painful.
and and this boy, he was having migraine since he was a small boy. And one day I told his mother, the mother was my client. So the mother came for plantar fasciitis and some pain in the shoulder, and everything was going away with TRE. Also plantar fasciitis, that it's a very annoying thing. It hurts a lot and it goes
Yeah.
away. I had that too, actually, and it disappeared completely with TRE.
Oh,
I
wow.
always think about my ankle, but at that time I had like plantar fasciitis as well, and it went away. So the mother told me, okay, so I will try to bring him and we see what happens. So
Mm-hmm.
he came, And he really struggled with migraines because it was affecting his life. So he's autistic, so he's already very sensitive to noise and light, and migraines were making it even worse. So it was really affecting his family life, life at home, at school, everything. So he tremored, and the migraines disappeared as well. So he was having migraines, not always severe, but it could be severe. The pain could be severe from time to time, but he was having mild migraines often and persistently. And he tried different things. And then with TRE, well, he actually experienced relief. And then every time he would like start to have a migraine, he knew that he could tremor and then the pain would disappear or not even get itself.
How old was the boy when he came to you?
13.
13. And he had a migraine from very young age.
Mm-hmm.
Wow.
Yes, he was like 2 or 3 years old, but very young.
Wow. Wow. What a relief. And, a great tool for him to actually take on to take care of himself and not being subject to this severe migraine. That's really touching.
And for me, the greatest thing is that, so he's not even my youngest, but my youngest client, but these people are so young and very young. They have this tool that actually can solve a lot of problems in life. So it's great for chronic pain, but it's also good sometimes for other kinds of pain and for stress. And then they can use it from a very young age because they know how to do it.
Yeah, yeah. I think it will be like super empowering for him. So he wouldn't be afraid of this migraine coming on anymore. He knows how to deal with it, not suffer it anymore. I think it's super empowering.
So I had another client, very young, even younger, so 11 years old, a girl
Wow.
with like pediatric rheumatoid arthritis.
Uh-huh.
And so she had a lack of mobility and pain due to the polyarthritis. And she came also, well, with the mother. So the mother was my client in the beginning. And then she thought, oh, maybe this could help my daughter with pain, TRE. Would it be okay if I bring her? And I was like, bring her on, like the worst case scenario is that it won't do anything, but why not? So she brought her daughter, and the daughter had, it was hard for her to climb the stairs, for example, in my studio. And also to do the exercises. So I really had to adapt the exercises and avoid some because it was too painful for her. And she was in between treatments for the polyarthritis. And the doctor told her that she was expected to arrive in the next treatment, that was like 3 months later, in a wheelchair. So they were preparing themselves for a wheelchair.
Wow.
And she was very, very young. And so they tremored in the first time, mother and daughter, and then they left. So the mother was feeling much better. The daughter was like waiting to see. And the next day, the mother sent me a message early in the morning saying, okay, she woke up and she has no pain.
What?
Yeah, so it was really
She
impressive.
she's 11 years old. The doctor told her in 3 months her condition would be worsened enough that she can't walk and she'll be in a wheelchair. And then she tried TRE one time, and then she woke up the next day without pain.
So no wheelchair for her, actually. So in August, when she arrived, she was walking normally. So her mobility came back.
What?
She started to move like I don't like to use the word normal but I don't know how to say it differently. So she started to move like a girl of her age would move if she didn't have like
So she didn't have the restrictions in her movement and the range of the motions.
And then like when she came back to the studio for an interview for my podcast, she actually could run up and down the stairs. And it was so hard for her the first time, like to go up and even harder to go down. And she was moving fine.
I mean, that is incredible. I
And
was
her
about to
mother,
cry.
yeah, her mother was also thinking maybe perhaps she would need like an operation to her back, lumbar spine, because she had 2 hernias.
Mm,
And it disappeared as well.
wow.
Yeah, but I think, yeah, I think the mother was very, very stressed with her daughter's situation. And then we discussed the subject later, and yeah, we think it's her back pain was related to her daughter's condition. And once the daughter got better,
Mhm.
she also got better, and they were also able to uh, de-stress with TRE because it worked so well for both of them, actually.
Wow. So that's actually highlighting the back pain came from just stressing, worrying about her daughter's condition.
So she's a former nurse, and I think it's called doula in English.
Yeah, yeah.
So she she's not someone totally out of the like anatomic world, let's say like this. So she has a good understanding,
Yeah.
and yeah, so she thinks that it could be related to the stress experiencing.
Really amazing that when the doctors thought this young girl would actually be in a wheelchair and not
Mhm.
really improve, somehow trying TRE has a completely unexpected result of restoring her to a full
Mhm.
range of the motions. Um,
Yeah.
whatever was there, I mean, that is just
Mhm.
really amazing.
Yeah, yeah. Now she has like a normal teenager lifestyle.
Yeah.
It's
So how many sessions did you work with her?
so we did 4 sessions, but she tremored at home, so she still tremors, so she keeps doing it whenever she feels the need. And for me, that's the greatest thing of TRE, is that it's a natural reaction of the body, and then people, they can actually be independent, so they can do that on their own, and whenever they need, they can do it.
Mm-hmm.
So she did the 4 sessions, but in between sessions, she was tremoring as well at home,
Mm-hmm.
because she could make the tremoring come very easily, and then it got better and better. And then when, for example, she was traveling with her parents in the car, she would tremor, or for example, watching TV in the evening, she would tremor. And yeah, and now
So
the
she
whole
can even
family
actually
tremors.
tremor. So she
Yeah.
can even tremor even in a moving car.
Yeah, no, well, she became really into it, and she got really into it, and she started tremoring.
So is there any other interesting cases that you would like to share with me while we are here?
I have some other interesting cases with chemotherapy pain and fatigue. So
Yeah,
I had a client, she came, yeah, when she was doing chemotherapy. We tried TRE the day before she was having chemotherapy, and then she didn't have pain or fatigue after chemo.
really?
She was like, oh my God. And she called me like, oh my God, like, I'm feeling normal, I know I'm not tired, I'm not in pain, I'm just feeling good. And she also used tremors, and after the operation, so she was doing chemo, and then she was going to have surgery, and she also used tremor, and it helped her recover from the operation.
Really? So she was already in chemotherapy when she
When
tried the
yeah,
TRE and she was in
yeah.
between treatment. So she
Mm-hmm.
could tell the difference between, not having TRE done and having a chemotherapy done, and then have TRE done day before chemotherapy, and the result was very different. She felt better.
She did felt she did feel better, and but there is something that I would like to say here. For me, it's very important. So all this is great, but I always ask like for medical advice, or ask my
Yes,
clients to
yes.
ask for medical advice. And now there are doctors that are much more open to these holistic approaches. And but I also work with doctors that can help me when I have more complicated cases.
I
Okay.
see.
Yeah. So for me, it's important always to have like a medical opinion and like a medical, yes, you can do this. Because sometimes as I'm not a medical doctor, I prefer always to have like a medical backup.
Exactly. So you ask your client to get a permission from the medical doctor that it's safe for them to try TRE. Is that
In
right?
some cases, yes. Even if I do believe that TRE is a natural reaction of the body, but I prefer to, for
Exactly.
assurance, yeah.
All right. So if the doctor is not familiar with the TRE practice, how can the patients or clients, clear with their doctor if the doctor doesn't have an understanding about TRE?
There are websites they can learn about it, and I'm always available to explain as well. And it's not that I ask all the time, but in some cases I prefer, because I have no idea if there isn't like some kind of contraindication that I might not be aware of.
Okay.
So for example, if someone comes with back pain because it's someone with a lot of stress in life, but the person doesn't have like a particular health condition, then okay. But if the person has a particular or a special health condition, or something that for me it's not so easy, so I can choose not to take responsibility and don't work with the person, but I prefer to ask the person to ask the doctor. But often, so this client doing chemotherapy, she asked the doctor previous, so it was the doctor that told her to do something. So the idea was to strengthen and to strengthen and to stretch the body in order to undergo the surgery. So she already came with doctor's orders to do some kind of yoga, TRE, like something, yeah.
All of those are really amazing cases. I'm very pleased to hear that TRE was able to kind of help them, and you had a great result with them.
I
So
did have great, very good results with different kinds of pain, chronic pain, and and for me, what amazes me all the time is how fast it goes.
wow.
Sometimes in the same session, the person, I had a client with cervical spine, someone that had a pain in 8 in 10 when arriving.
Oh, really? Yeah.
And after the first session, so it was not spectacular. It's not that he left without pain, but the pain decreased 1 or 2 points. And that for me was already amazing. And then in the 4 sessions, the pain decreased until a 2. So it was
Really? Simply in by session 4,
4 sessions,
8 to
yeah.
2.
But I tell people, so when there are for me, this is kind of extreme pain case. So in these situations, I always ask the person if it's possible to practice at home in order to have like a faster result.
Yeah.
And I know we live in a world where, like speed is maybe, I don't know, we always want things very fast. But I think in the case of pain, if we can have a very fast result, why not? Because, let's face it, if we can do it, why not? And this can happen with TRE.
So the people who has a chronic pain, if they were to get a couple of sessions, like you mentioned, and then they learn how to tremor and they're practicing at home, do you have any advice that how they should practice?
It depends from one person to person, but in the beginning, I think not too much. So just because sometimes the tremors, it depends from one person to the other, but tremors, it can take some time in order to come easily or fast. So in this case, I think if we do it like every 2 days, like 10 to 15 minutes, it's okay. But then with time and practice, I think a daily practice, but short daily practice can be interesting as well. But also for stress and for sleep problems. But then we have the TRE self-regulation, and the person has to feel how it goes. And
Yeah.
this is really important, this self-regulation.
Okay. So every other day or every third day or so, 10 to 15 minutes, just start with that. Start slow. Depending on if they feel comfortable enough, they feel safe enough with these experiences and kind of like build it up. But your recommendation is rather than trying to do a long practice, just do a mini shaking, mini tremoring throughout the day.
Mini shaking is before going to sleep. Between brushing the teeth in the evening and going to sleep, mini shaking. Yeah.
Right. Great, great. Okay. Is there anything that you want to kind of share with us, before we close the conversation?
Drinking water can be helpful as well,
Okay.
along with the tremoring,
Okay.
because often it's stress, but it can also be related to connective tissue, and keeping hydrating is always good and helpful.
Okay. Great. Thank you so much for sharing your experience with me today. And I hope this is helpful for a lot of people who has a chronic pains.